Good afternoon, everyone. Welcome and thank you for joining us today at our retiree informational session, the first one of 2019. My name is Aja and I am a retiree benefits representative here at the University of Rochester. Joining me today is Zach Beatty, who is also a retiree benefits representative and will later be going over our Medicare eligible plans. In this session today, we will be going over a variety of topics such as eligibility to retire, Medicare, health and dental benefits, and other information you need to know regarding your retirement. If you have any questions, please feel free to ask through the Q&A tab during the last 10 minutes of the presentation, but you can always email us at retireebenefits@ur.rochester.edu later if you forget or think of something later on. So in the first half of this presentation, we will be going over eligibility, prior service credit, the health and dental plans, and a few other things. If you or your dependents are nowhere near age 65 or non-Medicare eligible, you do not have to stay for the second half of the presentation. However, if you are over 65 or nearing 65, then we highly suggest staying as we are going to be going over the Medicare eligible health and dental plans offered. So before you think about what health and dental plan you want to be on or what is available to you as a retiree, it is important to find out if you are eligible to retire in the first place. So when you begin your employment here, you are placed under a certain category or level. So you are a 3R if you were full-time or part-time faculty and staff, age 55 or over with 10 or more years of service on January 1st, 1996. Alternatively, if you were age 50 with 10 or more years of service on June 1st, 1996, then you fall into this category as well. You are a 4R if you were full-time or part-time faculty and staff, hired or rehired prior to January 1st, 1996 in a benefits eligible position, and you are at least age 55 with 10 or more years of service at the time you retire. Lastly, you are a 5R if you were full-time or part-time faculty and staff, hired or rehired after January 1st, 1996 in a benefits eligible position, and you are at least age 60 with 10 or more years of service at the time you retire. Please keep in mind that you do need to have 5 consecutive years of service leading up to your retirement date with no break in service in order to be eligible. Time as reported roles or per diem does not count as being benefits eligible, so make sure you are a full-time or part-time employee at the time of your retirement if you want to access our benefits. So what happens if you're not eligible to retire? If you decide you want to leave before your eligibility is met, then you will be voluntarily separating from the university. This means that you will not be eligible for any of our health and dental plans, tuition, life insurance, and other benefits that we will be going over. You will also not be able to receive a contribution amount towards your health care. However, that's okay because there are plenty of other options outside of the university in the marketplace that may be a better fit for you. A great website to check out is newyorkstateofhealth.newyork.gov, which gives you a comparison of all the plans out there in the marketplace and how much they will cost you or your dependents. So if you have prior service credit at the University of Rochester or another higher education institute, you can count those years of service towards your benefits. As I mentioned previously, ad hoc or per diem credit does not count towards retiree benefits. And also keep in mind that this will not change your retiree level. That will always remain the same. So if you're a 5R and you want to add 10 years of service, you will not automatically become a 4R, since it is based on the date of your hire or rehire. It only goes towards your benefits when counting years of service or points. In addition, teaching hospitals or hospitals in general do not count towards your benefits. Only another higher education institution or previous benefits eligible position here at the university. If you do have prior service credit, you can go online and fill out a form, and you can just send it to us for approval. So the topics we will be discussing today include health and dental care, life insurance, tuition benefits, retiree ID cards, and a few other incentives. So once you retire, you have a few options depending on which category you fall under about your healthcare plan. If you are under 65, you can continue on a non-Medicare eligible plan, either the PPO or the HSA plan. The coverage will be the same, but it will be at a higher cost because you will now be paying for the full cost of the plan. And you can find those rates on the Total Rewards website under retiree benefits. Now, if you're Medicare eligible, you can choose from one of the 5 plans that we have to offer. So one of those plans are directly administered through the university, and the other 4 are through MVP Healthcare, which Zach will be covering later on in the presentation. So there are 4 important components that you need to know about Medicare: what makes you eligible for Medicare, all the parts of Medicare, so parts A, B, C, and D, what enrollment periods to pay attention to, and when you should and should not enroll in Medicare. So who is currently eligible for Medicare? Individuals who are age 65 and older, who have paid their Medicare taxes for at least 10 years, individuals under age 65 with certain disabilities, individuals of all ages with end-stage renal disease, which is permanent kidney failure requiring dialysis or a kidney transplant. And there are 4 parts of Medicare. The 2 most common are known as Original Medicare, which is Parts A and Part B. Part A is hospital coverage, so inpatient care in hospitals, including critical access and long-term care. Part A is typically a free benefit and you do not need to pay a premium. However, with Part B, you do need to pay. The premium does depend on your household income, and for 2019, it is about $135 per month. Part B is your medical coverage, so your doctor's services and your outpatient care when it is medically necessary. Part C of Medicare is a Medicare Advantage plan. Medicare Advantage plans, which is what we will be going over later, include Part A and Part B that offer extra benefits, along with credible drug coverage towards Medicare Part D, which is the last one. So Part D is prescription drug coverage. Part D is available in standalone plans or as part of a Medicare Advantage plan. You will find that most of our plans have credible coverage towards Part D or Part D prescription drug already built into the plan. So there are 2 enrollment periods that you need to know before making the decision to retire. First, your initial enrollment period. Your initial enrollment period comes into play when you are planning to retire around your 65th birthday. It is a 7-month time frame, 3 months prior to the month you reach age 65, the month you reach age 65, and 3 months after. So if you are planning to retire around your 65th birthday or your initial enrollment period, you will want to sign up for Medicare Part A and Part B on your own, at least 3 months prior to turning 65. Now, if you were born on the 1st of a month, your Medicare will take into effect the 1st of the month prior to the month you turn 65. So for example, if your date of birth is October 1st, your Medicare will actually kick in September 1st instead. If you are in your initial enrollment period, we do not fill out the paperwork for you, so you are responsible to fill out the Part B application and bring it down to Social Security on your own. The next slide will show you a better visual of when to sign up for Medicare during this period, depending on when you want this to become effective. Now, second is your special enrollment period. Your special enrollment period occurs when you are continuing to work past age 65 and past your initial enrollment period, or you are already Medicare eligible due to disability. This is one of the many reasons why it's important for you to contact us at least 3 months prior to your retirement, especially when you are over 65, so we can process and send off the paperwork on time. So back to your initial enrollment period, the period when you would need to sign up on your own if necessary. This chart shows when you should sign up and when your effective date will be. So remember, Part B is medical coverage that requires you to pay a premium. In order to become effective for Part B, you need to make sure you sign up for Part A as well, which can be done online or at your Social Security office. So if you apply for Medicare 1 to 3 months prior, before you reach age 65, your Medicare will begin the month you turn 65. If you apply the month you turn 65, you will be effective the month after. So it is extremely important to know the timing of when and when not to apply for Medicare, which leads us into the next slide. So to summarize what we talked about earlier, the Medicare enrollment is necessary when you are turning 65 and already retired, which is your initial enrollment period, and if you are working past age 65 and plan to retire, your special enrollment period. You do not need to apply if you are continuing to work in an active benefits eligible position, which is either full-time or part-time. For those of you who are currently contributing to an HSA account, it is very important to understand how having an HSA and Medicare work together. In order to avoid penalties from the IRS, you do have to stop contributing pre-tax dollars to your HSA account 6 months prior to applying for any parts of Medicare, so Part A or Part B. This is because when you enroll in Part A and Part B, you receive up to 6 months of retroactive coverage, not going back farther than your initial month of eligibility. So in other words, the IRS does not want you double dipping coverage. If you're already collecting Social Security benefits, you may automatically be signed up for Part A already. If you are worried about this in any way or confused at all you need to do is contact our active healthcare area team, and they can help you with the process of zeroing out your contributions, answering any questions you have, if you plan to retire in the near future or you want to enroll in Part A. So next we will be continuing to discuss more information about our benefits and topics such as the billing cycles once you retire, of the health and dental plans, how to calculate the cost, how much the university contributes to your healthcare plan, and other incentives the university has to offer. So all of our Medicare eligible plans either supplement or coordinate with Medicare Parts A and B. They offer prescription drug coverage to Medicare Part D or credible prescription drug coverage towards Medicare Part D. Therefore, in order to obtain the full benefit of the plans, you must be on Medicare Part A and Part B. So the way that the healthcare costs work here is that the retiree and the university share the cost of the healthcare plan coverage. The cost of your plan depends on a variety of topics such as which retiree level category you fall under, so if you're a 3R, a 4R, or a 5R, and the coverage that you select. So we will not be going over how much each plan costs today because it will be a lot of information, but again, you can visit our website where you will find the rates of each of the plans. So you will receive a bill quarterly once you retire every March, June, September, and December for both your health and dental. And you can be on one or the other. You do not need to be on both the healthcare and the dental. You can just be on one or the other. So one of the main reasons why it is important for you to retire full-time first, regardless of if you plan on returning to work or not, is to lock in your contribution amount. A contribution is money that the University of Rochester gives you towards your healthcare once you retire. It does not go towards your dental, just your healthcare plan. So as you can see, contribution amounts do vary based on your retiree level. So if you are a 3R, your contribution amount is already built into the healthcare premiums. Therefore, what you see is what you pay, and it is a flat rate. If you are a 4R, your contribution amount is based on a point system. So what we do is we take your age and your years of service and add them up together, which equals a total amount of points. With this level, your contribution amount increases once you reach age 65. Lastly, if you're a 5R, your contribution amount depends on your years of service at the university, and they're locked in at the time that you retire. Your contribution does not increase once you turn 65, so once you retire, your rate will be locked in at those amount of years that you worked. For all levels and contributions, you will never lose your contribution. Our current policy states that if you choose to get coverage outside of the university and then you want to decide to come back later during open enrollment, you can do so and your contribution amount will still apply here. So now we will begin going over the contribution amounts for the 4s and 5s, starting with the 4Rs who are under 65. So remember, we take your age and your years of service at the university and add those up together. So if you have 85 points and you are under 65 on a single contract, you will receive $83.33 towards your healthcare plan. If there is anyone more than you on the plan, it is $166.67. Please note, if you are a part-time employee, your contribution amount will be cut in half. So these amounts that you see here are going to be halved. If you can retire while you are full-time and you know that you will be taking one of our healthcare plans once you retire, then we highly suggest doing so. Once you turn 65, your contribution amount goes up for the 4R retirees. For a healthcare plan with single coverage, you will receive $207.52 with 85 points, $415.04 for a couple who are both Medicare eligible, and we even have a category for one spouse who is Medicare eligible and one spouse who is non-Medicare eligible. Again, these amounts will be cut in half if you retire while you are at a part-time status. So here's an easy formula on how to calculate your monthly cost. Once you find the premiums and select which plan you are interested in under your retiree level, take the healthcare premium, subtract your contribution amount, and you will get your total monthly cost. So for example, you're a 4R with 85 points, and both you and your spouse are over 65. You want to be on the Preferred Gold Standard Plan, which the plan costs $509.28 for 2019, and your contribution amount would be $415.04. So your total cost is going to be $94.24 per month, which gets billed quarterly. So one thing to think about is that on top of your monthly healthcare premium, you will also have to pay your Medicare Part B premium separately, which is about $135 a month. Unfortunately, it is not included in our Medicare eligible plans, and it is a separate cost aside from the plans through the UVAR. So moving on to those who fall under a 5R category, those hired or rehired after 1/1/1996, your contribution is solely based on your years of service. This is when prior years of service come into play, because the more years of service that you have that count as credit, it increases your contribution amount. But remember, it does not change your retiree level. You cannot go from a 5R to a 4R just because you added extra years of service. So if you have 17 years of service and you retire at age 65 and older, you'll receive $148.32 towards your health care. However, if you retire between the ages of 60 and 64, you'll receive $74.16 at 17 years of service. So if you are eligible for retiree benefits, you can also continue to enjoy our dental plans, either the traditional or the medallion plan. The cost does change and it increases once you retire, but it is still the same coverage. You are also billed quarterly for the dental as well, and the cost varies based on your retiree level. You can also find the dental rates on the website. So if you have the group life insurance with us, if you have the basic life insurance policy, your coverage terminates at the time of your retirement. If you would like to continue the basic policy, you will need to contact our voluntary benefits department for more information. If you have anything more than the basic policy, which is an employed paid optional plan, you may need to continue this coverage as well, but you need to contact Securian once you retire, and you will start to pay a premium to them directly. The employee paid optional coverage is the same rate as active coverage, but it can increase based on a higher age bracket or change in the group university rates. So if you'd like to change who your beneficiary is, there are two ways. You can log into HRMS and click on Securian Life, or go directly to the Securian website where you will type in your username and password. If you want this slide, you can go directly to our website where this entire presentation is posted and available to you. And the website is just rochester.edu/total rewards, and you'll just click on retiree benefits. So retirement is a perfect time to go back to school. You will remain eligible for tuition benefits if you do go back to school for any courses. Full-time and faculty and staff, you are eligible for a 70% tuition waiver for 2 credit-bearing courses per semester. If you are part-time, you are also eligible for a 70% tuition waiver, but only for 1 credit-bearing course per semester. If you have any dependent children, they will remain eligible for tuition benefits, regardless of whether they began college before you're retired. So we offer Your Benefits Extras, which is a website ran by CoreStream, offered to the U of R employees and now available to retirees. All you have to do is go on their website and type in your first, last name, and your 6-digit employee ID, and you can access the benefits offered to you, such as group auto and home insurance, Hyatt legal plans, BSP vision care, and many other incentives that might be beneficial. If you're having trouble with logging in, you can contact CoreStream directly by their phone number or email listed, and they can help you get started. Another great benefit we still offer to retirees is rares.org, discounts and perks. It's not shown on this page, but we used to have My Better Benefits. We recently switched over to Rares. So if you log into their website and type in the member ID Rares35, you can get access to a bunch of discount deals. Another great benefit that's available still is you can actually redeem a retiree ID card once you are officially retired. So this gets you continuous access to the university library, health services, employee pharmacy and discounts, athletic facilities, Melior dining, and free parking off of Kendrick Road, Lot 9. They most likely will not be able to give you the card right away, and it may take a few weeks for them to send you the card once you contact the ID office. They'll want to see that you are officially retired and your department has you in the system as retired before processing your new card. So here's a summary of the key factors that we really want you to remember going forward. If you are considering reducing time, it is recommended to retire while full-time before transitioning into a part-time or time as reported position. If you return to work part-time, you and your dependents can continue with part-time active benefits, even if you are nearing age 65 or past age 65. You and your dependents do not need to sign up for Medicare until you stop working in a benefits-eligible position, which is either full-time or part-time. If you plan on returning to work time as reported, contact the Office of Total Rewards for your benefit eligibility. If you retire with no return to work and you turn 65 later on, you will sign up for Medicare on your own, which is your initial enrollment period. Employees looking to retire should make sure to contact us no earlier than 3 months prior to retirement for those who are age 65 and older. Employees retiring under 65 or those planning to return to work should plan to meet with us at least 2 months prior. Each scenario does require different timing. So, where should you begin? Contact the benefits office 3 months prior to your set retirement date. Decide before the meeting what you'd like to do. If you want to come back, if you want to fully retire, or come back part-time or time as reported. Then meet with a retiree benefits representative. Once we give you the proper paperwork at the one-on-one meeting, you will return the paperwork back to us 2 to 3 weeks before you retire. Then you can start your journey. We encourage you to stay in touch with the U of R for any updates or changes that might be going on in regards to your benefits, because it is important to us that we also have your updated information in the system just in case we need to get a hold of you. So please make sure to email us once you retire if anything does or has changed. So a few recommendations we have for you. Visit our website for more information. You can find all the helpful information that we went over today. Follow the retirement checklist, which you can also find online. Set aside time to do your own research at home. There's only so much that we can do for you. We can guide you in the right direction throughout the process, but it's really up to you as the employee to take the necessary steps to make sure you have a smooth transition. We also have retirement support groups every third Monday of each month. We host a support group that's geared towards those who are nearing retirement and need a little help and guidance. It can range from 5 to 15 people per group, and we have a great counselor named Beth. She gives you some support and strategies to help you and lead you in the right direction. If you have any questions, emailing us is the best way to get a hold of us. So feel free to ask any questions that you forgot to ask today or want to ask down the road. So before we go any further, if you don't want to stay and listen to the Medicare eligible plans we offer, you are more than welcome to exit the webinar at this time. Again, this presentation is available on the Total Rewards website. So if you want to print it and go through it later, you can do so. I will now have Zach Beatty take over and go over all 5 of the Medicare eligible plans. Thank you.
Okay, good afternoon, everyone. I'm going to be going over the Medicare Advantage plans offered here at U of R. So as you can see here on this slide, we have 5 plans. The first one is the Complementary Care Plan with Major Medical. Now, this plan is a true supplemental plan to Medicare, and we'll go into a little bit more detail about what this plan covers. The other 4 plans, as you can see on the right-hand side, are MVP plans. Now, we do not offer Excelis, Aetna, United Healthcare plans, AARP, with the University of Rochester as retiree healthcare plans. But you are able to go and get those plans on the open marketplace if you would like. Okay, so for the University Complementary Care Plan with Major Medical, like I said before, it's a supplemental plan. It provides coverage for retirees and whoever is enrolled on the plan residing anywhere in the world. You are not limited to a network of providers, but make sure you're aware if you do travel outside the U.S. that preventative care is not covered. There will be a medical deductible to meet individually of $126 per person with an out-of-pocket medical cost of $300. Even though if you have a spouse or domestic partner on the plan, everything is considered individuals in Medicare's eyes. So each of you will have this deductible to meet. So just kind of a quick snapshot of what is covered by this plan. After the deductible is met, you'll have to pay 20% coinsurance for primary and specialty visits. As you can see here, inpatient hospital stays, outpatient surgeries are all covered in full. Skilled nursing, days 1 through 120 are covered at 100%. Any days initially after that are covered at 80% after you've met that major medical deductible. And some therapy is covered at 80%, such as physical, speech, and occupational. Something very important with this plan, routine eye exams and routine hearing exams are not covered. As you can see on the bottom, this plan does come with prescription drug coverage. Individually, you will need to meet a $829 deductible. Once you do that, it will be a 20% coinsurance and with an out-of-pocket maximum of $1,700 for your prescriptions for the remainder of the year. So let's say you enroll in this plan on March 1st. This plan will cover you from March 1st until December 31st of that current year. It doesn't go from March 1st of 2019 through March 1st of 2020. These deductibles and these out-of-pocket maximum only last for 1 calendar year. And then it resets January 1st of the next year. So now what we're doing is going over the MVP plans offered here at U of R. So how do Medicare Advantage plans work? It takes the place of Medicare. Your Medicare and your prescription costs will be covered by MVP. Referrals are not required, and your MVP ID card you can use for your services. You can put your Medicare card that you get directly from Social Security away. You won't necessarily need that. They're really easy to use. There's no claim forms, and I would say they're more user-friendly than Medicare supplemental plans because you would go through MVP for all your claims and questions. Like I just said before, the Medicare Advantage plans, eligibility and enrollment. So you need to be signed up for Medicare Part A and Medicare Part B. You will continue to pay your Medicare Part B premium separate. No matter what, when you get enrolled in Medicare Part B, you will have to pay for that for the rest of your life. Even if you do get enrolled in one of our plans or a Medicare Advantage plan outside of U of R, you still have to pay for your Medicare Part B premium. Some plans have residency requirements. And enrollment, again, is individual. There is no family or 2-person contracts, but we do allow spouses and domestic partners to be on the plans. MVP coverage does travel with you. So no matter which MVP plan you're on, our emergency care is covered around the clock and around the world. You only pay your in-network copay. You're covered in full if you are hospitalized in emergency situations. Urgent care needed, you're covered worldwide. Again, you will only pay your in-network copay. So your out-of-pocket maximum. With all MVP plans, there is no deductibles. On day 1, when you start the plan, you will have to pay the copays listed for the medical services. There is no deductible to meet. And MVP does have an annual out-of-pocket protection of $4,000 per person. They'll pay 100% of the benefits on the right-hand side, or excluding the benefits on the right-hand side. But this $4,000 does not include something very important, the prescription drug coverage. So it does not include the monthly premiums, the coverage, acupuncture, eyewear, hearing aids, and some expenses for your major medical. So now we'll talk about the preferred gold with University Major Medical. So this plan is an HMO. An HMO stands for Health Maintenance Organization. For Medicare Advantage plans where doctors, hospitals, and healthcare professionals set services at a certain amount of money. And they do have an out-of-network. For the preferred gold with University Major Medical, there is a 16-county residency requirement which you need to get services in. If you go outside of that residency requirement, you will have to pay a 30% coinsurance for your medical services. MVP covers you at 70%, you will pay 30%. There isn't a $5,000 maximum that MVP will pay if you choose to have services done outside of the residency requirement. But like we said in the previous slide, emergencies are covered just as though it happened in network. So again, this is just a quick to show you where the preferred gold standard residency requirement is. Everything in the orange, almost on the left-hand side, is in network. Everything else in the red, from Steuben County all the way over to Saratoga, Warren, all the counties not in the are in the red, you will not be able to get services done. If you do, it would be considered out of network. You would just pay a higher cost for that medical service. So here's just a quick look at some of the co-pays if you were being enrolled in the preferred gold with Major Medical. Now, the prescription drug coverage, it's the exact same thing as the complementary care plan with Major Medical. The prescription drug coverage as far as the deductible and the out-of-pocket for the prescription coverage, $829 again, and a $1,700 out-of-pocket maximum for your prescriptions. The preferred gold standard HMO with MVP. Now before, if you did have pick the plan that does have the Major Medical, you would select either Aetna or Excellus as your third-party administrator for your Major Medical. But these next three plans that I'll talk about, MVP is your primary insurer for everything, medical as well as prescription. So we already talked about what an HMO and the point of services. It's the exact same thing as the preferred gold with Major Medical. This plan, you can reside anywhere in New York State, but not including the 5 boroughs down in New York City and Vermont. If you are getting medical services done within these areas, it will be the copays for in-network. If you travel outside of New York State or Vermont and you choose to have medical services done, you'll pay a higher percentage. Here is a quick glance of what some of the copays are for the medical services. The same thing. Urgent care is covered worldwide at a $30 copay. And then the physical, speech, and occupational therapy is covered in full. The same with the home health care. Now, skilled nursing facilities is very important. So days 1 through 20 are covered in full. Any day after that, 21 through 100, is covered at $160. Each year, we get a report from MVP that shows us roughly skilled nursing lasts anywhere between 15 and 18 days. So it's usually below that 20-day mark. Now, something extremely important with this drug plan, it is has something called the coverage gap or the donut hole, as you can see on the bottom right-hand side. So basically what this plan is, you need to make sure that your prescriptions are less than $3,820. What you pay as far as the copays and what MVP pays. So you'll add both of those costs up together to show you what your monthly cost will be. Because let's say you're on a tier 2 drug. Tier 2 drugs are generic. $10 copay is what you'll pay your pharmacy. But let's say on the back end, MVP covers $90. Let's say the actual retail cost is $90. Theoretically, that one prescription that you're on costs $100. Your $10 copay, which you pay, plus MVP's $90. So if that's the only prescription that you're on, your drug cost for 1 month is $100. Multiply that times 12, or how many ever months remaining in the month or in the year that you sign up in. If you are under $3,820, you are good. You are not in the donut hole. If you happen to fall in the donut hole, you will have to pay a higher percentage for the remainder of the year until you hit $5,000 in out-of-pocket medical, or excuse me, out-of-pocket prescription drug costs. Now, for the Gold Anywhere PPO with MVP. So PPO stands for Preferred Provider Organizations. This is a little bit more flexible. You have more room to go to different hospitals, doctors, and healthcare providers across the country. It's the exact same residency requirement for the Gold Anywhere as it was for the Preferred Gold Standard. So when you are in network, when you're here in New York State and get your primary care physician visit done, it's a $10 copay. Let's say you go out of network. It'd be a $25 copay rather than just a percentage. Some medical services do have percentages, such as inpatient stays or non-emergent. Again, if you are outside of New York and you happen to have an emergency, you'll be covered as though it happened in network, even if you are on the Gold Anywhere plan. With all MVP plans, there is routine annual eye exams, as you can see on the bottom. $15 copay if you get it in network, $25 copay if you get it outside of New York. Now, for the prescription drug plan for the Gold Anywhere, as you can see, there is no coverage gap or donut hole. What you see is what you'll pay every single time. Even if you do reach $3,820 in total drug costs, you will still pay the copays listed above. So if you are on a tier 4 prescription, usually tier 4s and tier 5s are anywhere retail between $800 and $1,500, you will pay a $60 copay no matter how many times you get that prescription. Now, the USA Care Plan. So this plan travels best with retirees. If you happen to live outside of New York, this is the plan. If you do want to be enrolled in coverage at U of R, this is the plan to be on. You can reside anywhere in the United States or Puerto Rico. And you can choose any doctors or hospitals, healthcare providers that contract with Medicare. There is no in-network with this plan because technically you are always out of network. So even if you get a medical service is done here in Rochester or California, it'll still be the exact same cost. If you were to get a surgery here, or if you wanted to get a surgery done at the Cleveland Clinic, it would be covered in full, outpatient surgery. Just like with the Gold Anywhere plan, the USA Care Plan has the exact same prescription drug coverage, no donut hole, and you would just pay the copay depending on which tiers your prescription fall under. All things that MVP plans provide: eyewear allowance, hearing allowance, and true hearing discounts. So if you need any glasses or lenses, things like that, MVP will give you $100 every 2 years. For hearing aids, batteries, and hearing equipment, it's $600 every 3 years, as well as they partner with True Hearing, so you can get higher discounts on all of your hearing aid needs. And preventative services are covered in full when you do them in-network. So if you are on the Preferred Gold Standard plan and you happen to be in Florida, make sure you get your annual preventatives done in New York State and they'd be covered in full. CVS Caremark. So CVS contracts the MVP as far as their mail order prescriptions go. So if you do want the 90-day supply, you would just have to pay 2 copays rather than 3, and you'll get your 90-day drug supply. But you are not limited to CVS pharmacies. You can still get your prescriptions filled anywhere you would like. So telemedicine is something that's extremely new, and MVP does offer it. So now you can use your smartphones, your tablets, and computers rather than go out in snowstorms, or if you can't drive yourself to the doctor or the hospital. But this, again, is not for emergency situations. It's just for general situations such as colds, flus, infections, or allergies, and you can't see your regular doctor. It's 24 hours a day, and very important, as you can see on the bottom, the primary care physician copay applies. If it's for a mental health specialty need, it would be for the specialty copay, depending on which plan you are enrolled in. MVP does invest in your well-being. Something extremely popular is Silver Sneakers. It's a free gym membership. All across the country, gyms partner with Silver Sneakers. Here in the Rochester area alone, almost all providing gyms such as the YMCA, LA Fitness, Planet Fitness contract with Silver Sneakers. Once you get enrolled in an MVP plan, you and a spouse, you and a domestic partner can enroll in that gym free of charge. In the Wellness Rewards program, you can get a $75 gift card if you complete all of your annual wellness visits. You just need to make sure your doctor completes a form, submit that to MVP, and MVP will send you a $75 gift card. So we have updated our website. We are now called the Office of Total Rewards as of July of 2019, or excuse me, 18. So for any more information, all of the information that we went over today is on this website. So you'll make sure that you need to look on the right-hand side where you see the lawn chair icon, and that will be for retiree benefits. You can check out all the plans, the prices, and more information about retiree benefits, as well as contact information for us. So we'll be answering questions going forward. And you can submit the questions through the Q&A tab, and we'll answer them out loud or privately for the next 5 to 10 minutes. So again, you can email us these questions, or you can ask these questions in the Q&A, and hopefully we'll be able to answer them for you. Thank you for joining us. Have a great day.